Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Marissa Caudill. She is a child psychiatrist and entrepreneur. Today's Kevin MD article is How a Customer Relationship Management Tool, or CRM, can help physicians regain control and beat burnout. Marissa, welcome back to the show.
Thanks, Kevin. Thanks for having me back.
All right. What's your latest article about?
Well, I'm sure you are familiar with what a CRM tool is as Kevin MD, because you're obviously doing amazing outreach stuff. I really want to thank you for the forum that you provide for us to be able to speak to each other and the world. But many physicians in practice, and I myself was one of them, have no idea what the acronym CRM even means. I think 90+% of physicians, if I asked them, wouldn't know. So I wrote the article to help people understand what it is so they can start to brainstorm how it might help them. Business people have known about CRM for years and years. And essentially, these software tools are things you've probably heard of, things like Salesforce, Go High Level, MailChimp, ClickFunnels, ConvertKit. Many of us may have heard of these things or not, but essentially it's like email on steroids. It's a way to keep track of all of the people you might want to keep track of. Myself, my story is that I was a busy child psychiatrist working within the Southern California Kaiser Permanente system. And I was there for over 4 years. I had over 1,800 patients when I left. And as many of the people listening probably can relate, I was scheduled by other people from the moment I entered the office until I left. And I would see 13, 14 patients a day. And I would think, gosh, there's got to be a more efficient way for me to do this job. But I was so busy that I didn't have the bandwidth to actually, sharpen the axe. That Abraham Lincoln saying, if I had 6 hours to chop down a tree, I'd spend the first 4 sharpening my axe. I feel like as busy clinicians, we are never given that time by administration if we don't have control over our schedules to sharpen our axe. And for me, what I've learned since leaving my job at Kaiser is that when you take the time using a CRM to sharpen your axe, your impact clinically and professionally can be so much greater. Because when we're working clinically one-on-one with our patients, I myself, as a child psychiatrist, was joking back when I was working full-time, like, I must give this informed consent spiel about SSRI use in kids about 3 to 5 times every day. I really should make my own YouTube channel and have this be a video, but I never had time to record a video. And even if I had time, usually at the end of my workday, I just wanted to unplug. I didn't want to be making a YouTube channel. But now that I have separated from a busy clinical job, I can actually think better about what is the best way to get information out to people. How can I help parents support their kids' mental health? I mean, I'm talking just about my point of view as a child psychiatrist, right? But I think regardless of what field of medicine you're in, if you give yourself some downtime to think about how would I really want to share my amazing information, experience, education with my patients in a way that's useful, you're limited when you're only one-on-one with your patients in the clinic, right? Because you have some days when you're having a great day and you're on a roll and you're really sharing information that you feel like people can use. And you have other days when inevitably you're going to be overwhelmed or kind of feeling frustrated or running behind, and you're going to be more rushed, and you may not go through things in as systematic a way and as useful a way as you do on your best days. So what a CRM can do is allow you to nurture your patients, provide education to them, provide resources to them, because essentially you can have a list that you can contact to say, hey, I'm going to get on Zoom and host this webinar on such and such topic if anyone wants to join. Or would you like to join my newsletter? Maybe you send out a weekly or a monthly update with information in your field. So that's what I use CRM for. And do you want to add anything to do that? I mean, what do you use it for and how do you use CRM? Because I imagine you must have some kind of CRM behind Kevin MD, right?
I do. So, of course, the biggest thing would be the mailing list, of course. Well, and I think the biggest thing is that people consume information in such different ways. And there is a much bigger proportion that a lot of people think that still get their information from email. So I summarize weeks worth of articles on my email newsletter. And, people who subscribe to the newsletter tend to be your most engaged audience, right? So that's the way I primarily use Kevin MD, the newsletter, to kind of, keep in contact with these most engaged listeners.
And even though that was probably a lot of work for you to set up, it was a lot of work for me to set mine up too. Did you find as you started to feel the benefit from that engagement with the people who really are the folks who resonate most with what you're doing, that you felt more exhausted because you were doing more work, or did you find that you felt more energized?
So I think with all of these things, it's always going to be upfront, right? You have to put in the capital of resources. And once
Mm-hmm.
you get that done, it's not that it's automated, but the workload and the amount of effort and time that you put in is substantially less. So I think the learning curve, because it's not something
Mm-hmm.
that's often taught, that takes a lot of energy and resources. But then once you learn that and set up the workflows, and workflows is one of the things I'm pretty good at, once you set those up, then it becomes more routine.
I agree. It becomes more routine. And then I'm sure you feel this too. You start to reap the rewards in
Hmm.
an increasing way, right?
Yeah.
Like once you set up those automations and routines, let's say you're a physician who doesn't now have a newsletter, but you have a huge patient base. Maybe you're a nephrologist or a
Yeah.
cardiologist or a weight loss specialist. You may be kind of burnt out seeing thousands of patients in a system job like a Kaiser job or a university hospital job or a
Yeah.
healthcare system job. But if you can start engaging with the people who really know, like, and trust you the most in a way that they're going to be reaching out to you regularly and being like, thank you so much, that article was awesome, or giving you positive feedback, it really helps you to feel re-energized. At least it did for me,
Hmm.
with the reason that we went into medicine in the first place, which otherwise in the daily grind, we can kind of lose sight of that. So I just feel like many healthcare systems, many EMRs, they don't have this piece that
Hmm.
the business side CRM can provide to us. And that's why I started the company that I started this year called SuperDoc Tech, which is based on Go High Levels platform. And I love it because it really allows me to do so many things in one place with one log on. So I'm able to, have a top of the funnel for my parent coaching business, the Parent Doctor, where I can advertise on social media and say, like, hey, would you like to join my monthly book club? It's free, comment book below.
Hmm.
And I have an automation in place with my CRM where on any social media post, if someone comments book, they're going to get a link to sign up. I get their email. Now they're on my list. Now I can send out my weekly newsletters to them, let them know about upcoming events and workshops that I'm doing, invite them to learn more with me. So it's just a way that I now get more engagement from a wider base of people who are interested in me and what I have to offer. And I think as physicians, a lot of times it can feel uncomfortable to kind of put yourself out there in that way. If you are just working in a clinic and you don't have a YouTube channel or an
Yeah.
Instagram page, that step is in of itself a hurdle, but there's lots of people out there who can support you. And it is one of those things that the more you do it, the easier it gets. I mean, I was actually thinking this morning coming on this podcast, the first one I did with you, I was a little nervous. This one I'm much calmer.
Good.
And I was remembering to the very first podcast I ever recorded. And I want to go back and listen to it because I know I was a nervous wreck and it sounded horrible. But now I've
It's
done
great. It's
dozens
great.
of podcasts
Yeah.
and it gets easier as you do it, right?
Hmm.
So again, it's all about just getting started. Like if
Yeah.
you have the knowledge inside you that, and I think every physician has to acknowledge that we're great. Like we're amazing people. We have good hearts. We have good information that people need. And ultimately, if you're not willing to go outside your comfort zone and learn these tools to be able to reach more people, then you're not doing the service to the world that you could do. So I think we kind of have to ask ourselves, like, am I burnt out because I'm doing too much? Or am I
Yeah.
burnt out because I'm not doing enough that I know I could do to reach more people? So I think the cure to burnout is really feeling more in control and having
Yeah.
more agency. And so I think, investing the time, money, and energy that it takes to learn how to use a CRM tool, whether that's the one I offer or the one you're using or anyone, there's many out there. It's really worthwhile for physicians to do. And I think even for employed physicians, if you talk to your bosses, they're going to support you in that because
Hmm.
ultimately you're adding to their value of their brand. You're adding additional services for patient care. And if you're kind of one foot in the door, one foot out of the door, you can do it initially saying that, you're helping the group, but ultimately then you have a list of people that
Yeah.
if you do decide you want to go out on your own in private practice or something like that, you can connect with those people. You have a following.
Yeah.
So it's all about just kind of being willing to step out into the arena, as Brene Brown says, that Theodore Roosevelt quote, right? Like of just being able to stand out on your own, brand yourself
Yeah.
as the doctor that you are, and embrace that to attract the people who are out there looking for you. Because the problem is, I don't care who you are. I don't care whether you're good on camera, you have an accent, whatever it is, like you have something to offer and there are people who will want to listen to you in the world. But if you don't put yourself out there, then no one can find you. And I think CRM is a tool for you to
Hmm.
put yourself out there and connect with people in a really useful way.
So there's an obvious use case scenario for CRMs for physicians who have their own platform, like you do,
Mhm.
and of course what I do with Kevin MD. So you mentioned how it could also be useful for what you call systems physicians, right? Physicians who are employed, work for large healthcare systems. Give us some specific use case scenarios. I know you talked about it earlier, but go into more detail about people who are employed, for instance, are listening to your podcast and they're still just on the fence. I don't have a platform. I'm not like, Kevin MD, or I'm not like you. I don't have a coaching business on the side where I need to get clients. But tell me the use case scenario for physicians who just see 20 patients a day. They want to just go home and maybe disconnect from medicine. That's the majority of the physicians that are practicing today. So what's in it
Right.
for them?
Well, I think what's in it for them, and I think my husband is actually sort of the poster child for this. So he works in a W-2 position. He is a Medicare accepting geriatric psychiatrist. He loves what he does, it's aligned with his heart, and he's great at it. He's a great clinician. But he also wants to be able to offer people additional information and
Hmm.
education. And he has some patients who want to know really, how can I protect my brain? What about nutrition? They ask him all these questions in their 15, 30-minute visit that he
Yeah.
just doesn't have time to answer. So he's using this platform to give a newsletter to his patients
Hmm.
and to do monthly interviews with like a nutritionist
Yeah.
or an exercise specialist, and letting people know, what are the ways that they really can implement healthful habits and changes to make their brains healthier as they age. So that's one example. CRM can help you with other things too. So if you do have a private practice and you're spending a lot of money or thinking about spending a lot of money on SEO or
Hmm.
marketing, you should know that when it comes to finding you, most people use Google. That's the most common search engine.
Hmm.
And the cheapest way and best way that you can optimize your SEO is actually by having a lot of positive Google business profile reviews. And a CRM can help you automate that from your existing patient base and make it such that for each patient you see, they get an email saying, like, hey,
Hmm.
hope you had a great experience. Could you please rate us? And that's a way to automatically boost your visibility, your new patients, coming to find you, just your SEO. So there's a lot of use cases. And then I work with many physicians too who have their day job, but then they have some other idea. Maybe they
Hmm.
want to do a coaching thing on the side. Maybe you're an endocrinologist, but you want to do some like menopause hormone telehealth, or maybe you are a pediatric dermatologist, but you want to do some telehealth or coaching about parents to help their kids with eczema. These are all ways that we now can expand. And with technology, with Zoom, with online courses, there's so many ways that we can make ourselves available more broadly than we can in a clinic setting where people have to make an appointment and see us one-to-one, right? So a
Hmm.
CRM is another way that you can think about all the ways you can reach out to potential customers. And if you get to the point that you want to run ads, you can even be running ads for that, but even just word of mouth. You probably know a lot of physicians if you've been in practice in your community, other specialists who refer to you. In my case, as a psychiatrist, I know many other psychiatrists, therapists, educators, schools, and the CRM also helps me keep track of those professional networks in a way
Hmm.
that I wasn't doing before. So I have a separate list with tags of my professional network. And if I'm doing something new that I want my network to know about,
Sure.
I no longer have to sit down and think, okay, who are the
Yeah.
friends I know who I could email? I can just search for that tag of my professional network, send out an email. It looks like a personalized email because it says, hi, Kevin. It pulls in their name and it gives the information, and then it can share like a link or a website or a funnel for them to share with their patients. I can share a printable PDF that they can post in their office to send new referrals my way. There's just so many ways you can use it. And as you get into it and start to use it, your creative juices start flowing and you see all of the value it can bring to you.
We're talking to Marissa Caudill. She's a child psychiatrist and entrepreneur. Today's Kevin MD article is how a customer relationship management tool, or CRM, can help physicians regain control and beat burnout. Marissa, let's end with some take home messages they want to leave with the Kevin MD audience.
I think, having been there myself, if you are working in an employed job where you're feeling sometimes frustrated, feeling a little bit disconnected from the passion and fire in your heart that brought you to medicine in the first place, take a deep breath and think
Mhm.
about, what would it really look like in an ideal world if you were providing people with the information that you have, knowing that you have valuable information in your brain, how could you do that in a way that would feel better to you, reach more people, and be more efficient? And then ask yourself, okay, who can help me? Who's the person doing this that I can reach out to and take a step in that direction? Don't be afraid, because you can do it. Like the people who are doing this, you probably know some people in your area who are
Hmm.
on Instagram or on YouTube, right? And you probably think, oh, I could never do that. But the truth is, they have nothing that you don't have. So ask yourself, what would be something that would feel right to you, feel wholesome to you, feel aligned with who you are? You don't have to do something that doesn't feel right to you. You don't have to dance on TikTok, but like, think about what is something that I could do differently? How could I sharpen my axe in a way that would have me feel more in control? Because having more control is the cure for feeling burnt out. And it does take a little bit of effort and thinking about things in a different way, but the answers are all there. So if it's of interest to you, feel free to reach out to me, reach out to other people, and start exploring what you could do.
Marissa, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you, Kevin. Take care.